For the liver imaging techniques, multiple imaging modalities are available. The topmost is ultrasound. Ultrasound is one of the important radiological modality for the confirmation of the liver and liver pathologies. So therefore it is widely used, it is easily available, and it is non-invasive. Liver appear homogeneous on the ultrasound imaging. As you know that ultrasound picks all the soft tissue within the abdominal cavity, and intra-abdominal organs can easily be scanned by the ultrasonography. The one important thing is, due to the density difference, due to echogenicity difference, and due to different shape, organ can be visualized. As far as liver is concerned, liver echogenicity is slightly greater than the adjacent renal cortex, especially the right one. So it should be compared with the right renal cortex. So normally the liver parenchymal echogenicity should have been slightly increased than the renal cortex on the right side. After homogeneity, two important anatomical structures should be looked for are hepatic artery. Hepatic artery can be picked on using Doppler signals, so you can appreciate a pulsatile vessel with continuous forward flow, that would be hepatic artery. Portal veins are divided into multiple branches, so a radiating pattern from the porta hepatis with a reflective vessel walls. So important of, or you can say the difference between the hepatic artery and the portal veins are, portal vein has quite reflective walls, so that's why it can be easily picked on the ultrasonography, while hepatic arteries does not possess echogenic wall. If you put the Doppler flow on the hepatic vein or hepatic vein branches, so it will show a triphasic flow pattern with reversal of flow during the cardiac cycle. So on the ultrasound, liver parenchyma, liver homogeneity, portal vein branches, and hepatic artery analysis leads towards the pathological processes and help us to diagnose certain abnormalities. Another modality for the liver imaging is contrast enhanced ultrasound. Actually, after IV injections of microbubbles contrast agent, you can get improved characterization of the liver parenchyma, and you can pick if there is any pathology during the arterial phase and portal phase. So because during the arterial and portal phase the liver parenchyma enhances because of this contrast agent, which are actually microbubbles contrast agents. So this technique can also be used for the imaging of the liver, and it is also widely used. Another modality for the detection of liver pathology is computerized tomography. Computerized tomography can be seen in two ways, like non-enhanced contrast tomography and contrast enhanced computerized tomography. Like in non-contrast, you don't need to contrast, don't need to inject any contrast, and this can detect diffuse changes. For example, for the fat and iron deposition like hemochromatosis or fatty deposition, you don't need to put any contrast. And if in case there is any focal lesion, for example calcification and hemorrhage, they both points don't need to have any contrast. They usually liver gives attenuation value of 54 to 60 ounce or 8 to 10 ounce greater than the spleen. Like if you compare the CT density with the spleen, so the splenic CT density slightly lower, 8 to 10 ounce field is lower than the liver. So the liver attenuation, liver CT density would be 54 to 60 ounce field. So this is when you need to have non-contrast CTs, which is used for the fatty deposition or iron deposition. In case of any diffuse abnormalities, you need to have non-contrast. And if you suspect any calcification or any blood, so then again you don't need to have the contrast, simply non-contrast CT would be valuable. Now the contrast enhanced CT, actually this detect and characterize focal lesions, especially combination of early and late arterial phases, so you can pick the abnormality or pathology with portal, late and delayed imaging. One important point worth noting here that the majority of pathological solid liver lesions predominantly having arterial supply, so that you can use contrast enhanced CT to look for the arterial supply. Liver parenchyma normally receives 80% of its blood supply from the portal vein, so they will therefore appear low attenuation on portovenous imaging. When you're doing portovenous imaging, and if there is any lesion which is being supplied by artery, so that you can easily pick on portovenous imaging. MRI modality is widely used, and a wide range of protocols are also available, including breath hold, T1 weighted images and T2 weighted images. Another protocol is in and out of phase sequences, that is used for the detection of the fats, and diffuse imaging and T1 weighted images with gadolinium. If you want to detect the pathology with biliary system and you are trying to use MRI, so you can use dedicated heavily T2 MRCP techniques. If you want to pick the hepatic steatosis or iron or any fibrosis of the liver, so and especially you want to use and you want to look for the quantification of this abnormality using chemical shift imaging, T2 plus T2, relaxometry and elastography, these can be used to pick all these hepatic steatosis, iron overload and fibrosis, especially in liver fibrosis. So MRI is one of the useful technique, radiological imaging, that can be used for the liver imaging. So far the liver scintigraphy is concerned, it gives you a global view of liver and helps you characterization of a lesion. If in case CT and MRI is not valuable, if it is not available, or if you cannot pick all these points on the CT or MRI confidently, so the another option that you have, that is liver scintigraphy. Like technetium 99 sulfur collide or albumin collide is usually used. 90% is taken up by the Kupffer cells and 10% is taken up by the spleen. So therefore the technetium 99 sulfur collide and albumin collide is used. 99 technetium labeled red blood cells can be used if a hemangioma is suspected. So for the hemangioma you can use technetium labeled red blood cell, so this will pick up if there is suspicion of hemangioma. As far as FDG PET is concerned, it has a relatively limited role because of the fact that normally when you introduce this PG PET is normally taken up by FDG. So liver parenchyma is usually take up normal FDG, so therefore it becomes difficult to pick any pathology in certain cases. So one of the liver scintigraphy is available radiological imaging, which helps you to detect pathology of the liver.